NCLEX Practice Exam Questions and Answers 2026/2027. Question 1. In children suspected to have a diagnosis of diabetes, which one of the following complaints would be most likely to prompt parents to take their school-aged child for evaluation? Option A, polyphagia. Option B, dehydration. Option C, bedwetting. Option D, weight loss. The correct answer is option C, bedwetting. Bedwetting, enuresis, in a previously toilet-trained child is a classic sign of polyuria associated with new-onset diabetes mellitus. Question 2. A 3-year-old child comes to the pediatric clinic after the sudden onset of findings that include irritability, thick muffled voice, croaking on inspiration, hot to touch, sitting leaning forward, tongue protruding, drooling, and suprasternal retractions. What should the nurse do first? Option A, prepare the child for an X-ray of upper airways. Option B, examine the child's throat. Option C, collect a sputum specimen. Option D, notify the healthcare provider of the child's status. The correct answer is option D, notify the healthcare provider of the child's status. These are classic signs of epiglottitis. Examining the throat can cause severe airway spasm and occlusion. The provider must be notified immediately. Question 3. A client has been newly diagnosed with hypothyroidism and will take levothyroxine 50 micrograms per day by mouth. As part of the teaching plan, the nurse emphasizes that this medication, option A, should be taken in the morning. Option B may decrease the client's energy level. Option C must be stored in a dark container. Option D will decrease the client's heart rate. The correct answer is option A, should be taken in the morning. Levothyroxine increases metabolic rate and energy levels, so it should be taken in the morning on an empty stomach to prevent insomnia. Question 4. The hospital has sounded the call for a disaster drill on the evening shift. Which of these clients would the nurse put first on the list to be discharged in order to make a room available for a new admission? Option A, a middle-aged client with a history of being ventilator dependent for over 7 years. Option B, a young adult with diabetes mellitus type 2 for over 10 years and admitted with antibiotic-induced diarrhea 24 hours ago. Option C, an elderly client with a history of hypertension, hypocholesterolemia, and lupus, admitted with Stevens-Johnson syndrome. Option D, an adolescent with a positive human immunodeficiency virus test admitted for acute cellulitis 48 hours ago. The correct answer is option A, a middle-aged client with a history of being ventilator dependent for over 7 years. A chronically ventilator-dependent patient who is stable represents baseline health for that individual and is often the safest to transfer or discharge to home care. Question 5. At a community health fair, the blood pressure of a 62-year-old client is 160/96 millimeters of mercury. The client states that their blood pressure is usually much lower. The nurse should tell the client to, option A, go get a blood pressure check within the next 48 to 72 hours. Option B, check blood pressure again within 2 months. Option C, see the healthcare provider immediately. Option D, visit the healthcare provider within 1 week for a blood pressure check. The correct answer is option A, go get a blood pressure check within the next 48 to 72 hours. An isolated elevated reading requires follow-up in the near term, 48 to 72 hours, to determine if it is a sustained hypertensive issue. Question 6. What would the nurse expect to see while assessing the growth of children during their school-age years? Option A, decreasing amounts of body fat and muscle mass. Option B, little change in body appearance from year to year. Option C, progressive height increase of 4 inches each year. Option D, yearly weight gain of about 5.5 pounds per year. The correct answer is option D, yearly weight gain of about 5.5 pounds per year. School-age children typically have a steady, predictable growth rate, gaining approximately 5 to 7 pounds per year. Question 7. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 100.8 degrees Fahrenheit. The priority nursing goal for this client is: option A, maintain fluid and electrolyte balance. Option B, control nausea. Option C, manage pain. Option D, prevent urinary tract infection. The correct answer is option C, Manage pain. Renal calculi cause excruciating pain. Managing the client's pain is the highest priority intervention. Question 8. Which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Option A, angina at rest. Option B, thrombus formation. Option C, dizziness. Option D, falling blood pressure. The correct answer is option B, thrombus formation. Thrombus formation at the insertion site is a major risk following cardiac catheterization due to vessel trauma. Question 9. A child who ingested 15 maximum strength acetaminophen tablets 45 minutes ago is seen in the emergency department. Which of these orders should the nurse do first? Option A, gastric lavage is needed. Option B, acetylcysteine for age per pharmacy. Option C, start an intravenous dextrose 5% with 0.33% normal saline. Option D, activated charcoal per pharmacy. The correct answer is option A, gastric lavage is needed. If within 1 hour of a lethal ingestion, gastric lavage may be considered first to physically remove the unabsorbed pills from the stomach. Question 10. Which individual is at greatest risk for developing hypertension? Option A, 45-year-old African American attorney. Option B, 60-year-old Asian American shop owner. Option C, 40-year-old Caucasian nurse. Option D, 55-year-old Hispanic teacher. The correct answer is option A, 45-year-old African American attorney. African Americans have the highest prevalence of hypertension among ethnic groups, making this individual the highest risk. Question 11. The nurse is giving discharge teaching to a client 7 days post-myocardial infarction. He asks the nurse why he must wait 6 weeks before having sexual intercourse. What is the best response by the nurse to this question? Option A. You need to regain your strength before attempting such exertion. Option B. When you can climb 2 flights of stairs without problems, it is generally safe. Option C. Have a glass of wine to relax you, then you can try to have sex. Option D. If you can maintain an active walking program, you will have less risk. The correct answer is option B. When you can climb 2 flights of stairs without problems, it is generally safe. Climbing 2 flights of stairs without shortness of breath or chest pain is a standard metric used to determine if a patient's heart can handle the exertion of sexual activity. Question 12. Which of the following should the nurse implement to prepare a client for a kidney, ureter, bladder radiograph test? Option A. Client must be nothing by mouth before the examination. Option B. Enema to be administered prior to the examination. Option C. Medicate the client with Lasix 20 mg intravenous 30 minutes prior. Option D. No special orders are necessary for this examination. The correct answer is option D. No special orders are necessary for this examination. A standard Cub radiograph is a simple X-ray of the abdomen and does not require fasting, bowel prep, or medication. Question 13. The home health nurse visits a male client to provide wound care and finds the client lethargic and confused. His wife states he fell down the stairs 2 hours ago. The nurse should: Option A. Place a call to the client's healthcare provider for instructions. Option B. Send him to the emergency room for evaluation. Option C. Reassure the client's wife that the symptoms are transient. Option D. Instruct the client's wife to call the doctor if his symptoms become worse. The correct answer is option B. Send him to the emergency room for evaluation. Lethargy and confusion following a head trauma are classic signs of increased intracranial pressure and require immediate emergency evaluation. Question 14. A child who has recently been diagnosed with cystic fibrosis is in a pediatric clinic where a nurse is performing an assessment. Which later finding of this disease would the nurse not expect to see at this time? Option A. Positive sweat test. Option B. Bulky, greasy stools. Option C. Moist, productive cough. Option D. Meconium ileus. The correct answer is option C. Moist, productive cough. A moist, productive cough is an early finding in cystic fibrosis. In later stages, the cough typically becomes dry, hacking, and non-productive due to extremely thick mucus. Question 15. The nurse is performing a neurological assessment on a client post-right cerebrovascular accident. Which finding, if observed by the nurse, would warrant immediate attention? Option A, decrease in level of consciousness. Option B, loss of bladder control. Option C, altered sensation to stimuli. Option D, emotional lability. The correct answer is option A, decrease in level of consciousness. A decrease in the level of consciousness is often the first sign of increasing intracranial pressure or extending brain injury. Question 16. The nurse is speaking at a community meeting about personal responsibility for health promotion. A participant asks about chiropractic treatment for illness. What should be the focus of the nurse's response? Option A, electrical energy fields. Option B, spinal column manipulation. Option C, mind-body balance. Option D, exercise of joints. The correct answer is option B, spinal column manipulation. Chiropractic medicine is founded on the principle that physiological function is heavily influenced by spinal alignment and manipulation. Question 17. Which of these findings indicate that a pump to deliver a basal rate of 10 ml per hour plus is needed for pain breakthrough for a morphine drip is not working? Option A. The client complains of discomfort at the intravenous insertion site. Option B. The client states I just cannot get relief from my pain. Option C. The level of the drug is 100 ml at 0800 and is 80 ml at 1200. Option D. The level of the drug is 100 ml at 0800 and is 50 ml at 1200. The correct answer is option C. The level of the drug is 100 ml at 0800 and is 80 ml at 1200. At 10 ml per hour, 40 ml should be gone in 4 hours just from the basal rate alone. A drop of only 20 ml indicates the pump is not delivering the minimum required dose. Question 18. When teaching a client with coronary artery disease about nutrition, the nurse should emphasize: Option A, eating 3 balanced meals a day. Option B, adding complex carbohydrates. Option C, avoiding very heavy meals. Option D, limiting sodium to 7 grams per day. The correct answer is option C, avoiding very heavy meals. Heavy meals shunt a massive amount of blood to the gastrointestinal tract for digestion, which decreases coronary blood flow and can trigger angina. Question 19. A registered nurse who usually works in a spinal rehabilitation unit is floated to the emergency department. Which of these clients should the charge nurse assign to this nurse? Option A. A middle-aged client who says I took too many diet pills and my heart is racing. Option B. A young adult with alcohol withdrawal symptoms experiencing limb jerking. Option C. An adolescent on pain medications for terminal cancer with stable vitals and pupils equal and reactive. Option D. An elderly client who reports having taken a large crack hit 10 minutes prior. The correct answer is option C. An adolescent on pain medications for terminal cancer with stable vitals and pupils equal and reactive. Floating nurses should be assigned the most stable, predictable patients. The adolescent with stable vitals on chronic pain management is the most appropriate. Question 20. A client comes to the clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Option A, trichomoniasis. Option B, chlamydia. Option C, staphylococcus. Option D, streptococcus. The correct answer is option B, chlamydia. Untreated chlamydial and gonococcal infections are the most common bacterial precursors to pelvic inflammatory disease. Question 21. A client is receiving digoxin 0.25 mg daily. The healthcare provider has written a new order to give metoprolol 25 mg twice a day. In assessing the client prior to administering the medications, which of the following should the nurse report immediately? Option A, a blood pressure 94/60. Option B, heart rate 76. Option C, urine output 50 ml per hour. Option D, respiratory rate 16. The correct answer is option A, blood pressure 94/60. Metoprolol is a beta blocker that will further lower blood pressure. A starting systolic pressure of 94 is critically low and should be reported. Question 22. A nurse enters a client's room to discover that the client has no pulse or respirations. After calling for help, the first action the nurse should take is: Option A, start a peripheral intravenous line. Option B, initiate high-quality chest compressions. Option C, establish an airway. Option D, obtain the crash cart. The correct answer is option B. Initiate high-quality chest compressions. Current basic life support guidelines prioritize circulation, chest compressions, first in the CAB sequence for a pulseless patient. Question 23. The nurse prepares the client for insertion of a pulmonary artery catheter. The nurse teaches the client that the catheter will be inserted to provide information about option A, stroke volume, option B, cardiac output, option C, venous pressure, option D, left ventricular functioning. The correct answer is option D, left ventricular functioning. A Swan-Ganz catheter measures pulmonary artery wedge pressure, which is an indirect but highly accurate indicator of left ventricular function. Question 24. During an assessment of a client with cardiomyopathy, the nurse finds that the systolic blood pressure has decreased from 145 to 110 millimeters of mercury, the heart rate has risen from 72 to 96 beats per minute, and the client complains of periodic dizzy spells. The nurse instructs the client to option A, increase fluids that are high in protein, option B, restrict fluids, option C, force fluids and reassess blood pressure, option D, limit fluids to non-caffeine beverages. The correct answer is option C, force fluids and reassess blood pressure. A drop in blood pressure accompanied by a compensatory rise in heart rate and dizziness indicates hypovolemia. Forcing fluids will help restore volume. Question 25. The nurse anticipates that for a family who practices traditional Chinese medicine, the priority goal would be to option A, achieve harmony, option B, maintain a balance of energy, option C, respect life, option D, restore yin and yang. The correct answer is option D, restore yin and yang. Traditional Chinese medicine is fundamentally based on restoring and maintaining the balance between the opposing forces of yin and yang. Question 26. A nurse prepares to care for a 4-year-old newly admitted for rhabdomyosarcoma. The nurse should alert the staff to pay more attention to the function of which area of the body. Option A, all striated muscle, option B, the cerebellum, option C, the kidneys, option D, the leg bones. The correct answer is option A, all striated muscle. Rhabdomyosarcoma is a highly malignant tumor that originates in striated, skeletal, muscle tissue. Question 27. The nurse is caring for a client with a serum potassium level of 3.5 milliequivalents per liter. The client receives 40 milliequivalents potassium chloride in 1,000 milliliters of 5% dextrose. Which electrocardiogram pattern indicates the infusion should be discontinued? Option A, narrowed Q or S complex, option B, shortened PR interval, option C, tall peak T waves, option D, prominent U waves. The correct answer is option C, tall peak T waves. Tall, peak T waves are a hallmark sign of hyperkalemia, indicating that the potassium infusion has pushed serum levels dangerously high. Question 28. The nurse is preparing to administer an enteral feeding to a client via a nasogastric feeding tube. The most important action of the nurse is option A, verify correct placement of the tube, option B, check that the feeding solution matches the dietary order, option C, aspirate abdominal contents to determine the amount of last feeding remaining, option D, ensure that the feeding solution is at room temperature. The correct answer is option A, verify correct placement of the tube. Verifying tube placement prevents the fatal complication of administering feeding solutions directly into the lungs. Question 29. While planning care for a toddler, the nurse teaches the parents about the expected developmental changes for this age. Which statement by the mother shows that she understands the child's developmental needs? Option A, I want to protect my child from any falls. Option B, I will set limits on exploring the house. Option C, I understand the need to use their new skills. Option D, I intend to keep control over our child. The correct answer is option C, I understand the need to use their new skills. According to Erickson, toddlers are in the autonomy versus shame and doubt stage, requiring opportunities to practice their newly developed skills independently. Question 30. A triage nurse has 4 clients arrive in the emergency department within 15 minutes. Which client should the triage nurse send back to be seen first? Option A, a 2-month-old infant with a history of rolling off the bed and bulging fontanelles. Option B, A teenager who got a singed beard while camping. Option C. An elderly client with frequent liquid brown colored stools. Option D. A middle-aged client with intermittent pain behind the right scapula. The correct answer is option B. A teenager who got a singed beard while camping. A singed beard strongly suggests inhalation injury. The airway can swell and occlude completely within minutes, making this a life-threatening priority. Question 31. Regam is most often used to treat which combination of mother and infant? Option A, Rh-positive mother and Rh-positive infant. Option B, Rh-positive mother and Rh-negative infant. Option C, Rh-negative mother and Rh-positive infant. Option D, Rh-negative mother and Rh-negative infant. The correct answer is option C, Rh-negative mother and Rh-positive infant. Regam is given to an Rh-negative mother to prevent her immune system from developing antibodies against the Rh-positive red blood cells of her infant. Question 32. A 24-year-old female is admitted to the emergency room for confusion. This patient has a history of a myeloma diagnosis, constipation, intense abdominal pain, and polyuria. Which of the following would you most likely suspect? Option A, diverticulosis. Option B, hypercalcemia. Option C, hypocalcemia. Option D, irritable bowel syndrome. The correct answer is option B, hypercalcemia. Multiple myeloma destroys bone tissue, releasing massive amounts of calcium into the bloodstream, leading to confusion, constipation, and polyuria. Question 33. You are taking the history of a 14-year-old girl who has a body mass index of 18. The girl reports inability to eat, induced vomiting, and severe constipation. Which of the following would you most likely suspect? Option A, multiple sclerosis. Option B, anorexia nervosa. Option C, bulimia nervosa. Option D, systemic sclerosis. The correct answer is option B, anorexia nervosa. A critically low body mass index coupled with food restriction, induced vomiting, and constipation are classic criteria for anorexia nervosa. Question 34. A 35-year-old male has been an insulin-dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely suspect? Option A, atherosclerosis. Option B, diabetic nephropathy. Option C, autonomic neuropathy. Option D, somatic neuropathy. The correct answer is option C, autonomic neuropathy. Autonomic neuropathy is a complication of diabetes that damages the nerves controlling involuntary bodily functions, including bladder emptying. Question 35. A second-year nursing student has just suffered a needle stick while working with a patient that is positive for acquired immunodeficiency syndrome. Which of the following is the most important action the student should take? Option A, immediately see a social worker. Option B, start prophylactic azithromycin treatment. Option C, start prophylactic pentamidine treatment. Option D, seek counseling. The correct answer is option B, start prophylactic azithromycin treatment. Post-exposure prophylaxis with antiretroviral therapy, like AZT, must be started immediately to reduce the risk of viral transmission. Question 36. A 34-year-old female has recently been diagnosed with an autoimmune disease. She has also recently discovered that she is pregnant. Which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? Option A, immunoglobulin A. Option B, immunoglobulin D. Option C, immunoglobulin E. Option D, immunoglobulin G. The correct answer is option D, immunoglobulin G. IgG is the only class of immunoglobulin small enough to effectively cross the placental barrier and provide passive immunity to the fetus. Question 37. You are responsible for reviewing the nursing unit's refrigerator. Which of the following drugs, if found inside the fridge, should be removed? Option A, Nadolol. Option B, opened and use humulin N injection. Option C, urokinase. Option D, epoetin alpha intravenous. The correct answer is option A, Nadolol. Nadolol is a beta blocker that should be stored at room temperature, protected from light and moisture. Question 38. A patient tells you that her urine is starting to look discolored. If you believe this change is due to medication, which of the following of the patient's medications does not cause urine discoloration? Option A, sulfasalazine. Option B, levodopa. Option C, phenolphthalein. Option D, aspirin. The correct answer is option D, aspirin. Aspirin does not cause urine discoloration. Sulfasalazine turns it orange, levodopa turns it dark, and phenolphthalein turns it pink to red. Question 39. A nurse is reviewing a patient's past medical history. This history indicates the patient has photosensitive reactions to medications. Which of the following drugs is associated with photosensitive reactions? Option A, ciprofloxacin. Option B, sulfonamide. Option C, norfloxacin. Option D, sulfamethoxazole and trimethoprim. Option E, isotretinoin. The correct answers are options A and B and C and D and E, ciprofloxacin, sulfonamide, norfloxacin, sulfamethoxazole and trimethoprim, isotretinoin. All listed medications, fluoroquinolones, sulfonamides, and retinoids, are well documented to cause moderate to severe photosensitivity. Question 40. A nurse is reviewing a patient's medications during shift change. Which of the following medications would be contraindicated if the patient were pregnant? Option A, warfarin. Option B, finasteride. Option C, celecoxib. Option D, clonidine. Option E, transdermal nicotine. Option F, clofazimine. The correct answers are options A and B, warfarin, finasteride. Warfarin causes fetal hemorrhage and teratogenesis. Finasteride can cause abnormalities of the external genitalia in a male fetus. Question 41. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks how long red blood cells last in the body. The correct response is option A. The lifespan is 45 days. Option B. The lifespan is 60 days. Option C. The lifespan is 90 days. Option D. The lifespan is 120 days. The correct answer is option D. The lifespan is 120 days. A healthy red blood cell circulates and functions optimally in the human body for approximately 120 days before being destroyed by the spleen. Question 42. A nurse is putting together a presentation on meningitis. Which of the following microorganisms has not been linked to meningitis in humans? Option A, Streptococcus pneumoniae. Option B, Haemophilus influenza. Option C, Neisseria meningitidis. Option D, Clostridium difficile. The correct answer is option D, Clostridium difficile. Clostridium difficile primarily causes severe gastrointestinal infections and is not an infectious agent associated with central nervous system infections. Question 43. A patient asks a nurse which types of foods contain the highest concentration of folic acid. The correct response is option A, green vegetables and liver. Option B, yellow vegetables and meat. Option C, carrots and sweet potatoes. Option D, milk and dairy products. The correct answer is option A, green vegetables and liver. Dark leafy green vegetables and organ meats like liver are the richest natural dietary sources of folic acid. Question 44. A client with myocardial infarction is receiving tissue plasminogen activator. While on therapy, the nurse plans to prioritize which of the following? Option A, observe for neurological changes. Option B, monitor for any signs of renal failure. Option C, check the food diary. Option D, observe for signs of bleeding. The correct answer is option D, observe for signs of bleeding. Tissue plasminogen activator is a potent thrombolytic. The highest risk complication is severe hemorrhage, requiring meticulous monitoring for bleeding. Question 45. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following characteristics is not associated with Down syndrome? Option A, simian crease. Option B, brachycephaly. Option C, oily skin. Option D, hypotonicity. The correct answer is option C, oily skin. Oily skin is not a characteristic of Down syndrome. The condition is frequently associated with dry skin, hypotonicity, a simian crease, and brachycephaly. Question 46. A nurse is caring for an infant that has recently been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present? Option A, slow pulse rate. Option B, poor weight gain. Option C, decreased systolic pressure. Option D, irregular white blood cell lab values. The correct answer is option B, poor weight gain. Infants with congenital heart defects exhaust quickly during feeding, burning more calories than they take in, leading to poor weight gain and failure to thrive. Question 47. A patient is getting discharged from a skilled nursing facility. The patient has a history of severe chronic obstructive pulmonary disease. The patient is primarily concerned about his ability to breathe easily. Which instruction is best? Option A. Deep breathing techniques to increase oxygen levels. Option B. Cough regularly and deeply to clear airway passages. Option C. Cough following bronchodilator utilization. Option D. Decrease carbon dioxide levels by increased oxygen intake. The correct answer is option C. Cough following bronchodilator utilization. Using a bronchodilator opens the airway first, making a subsequent cough highly effective at clearing out deep secretions. Question 48. A 50-year-old blind and deaf patient has been admitted to your floor. As the charge nurse, your primary responsibility for this patient is? Option A. Let others know about the patient's deficits. Option B. Communicate with your supervisor your patient safety concerns. Option C. Continuously update the patient on the social environment. Option D. Provide a secure environment for the patient. The correct answer is option D. Provide a secure environment for the patient. Safety is the absolute priority in nursing care. A patient with dual sensory deficits is at a severe risk for injury, making a secure environment paramount. Question 49. A patient has taken an overdose of aspirin. Which of the following should a nurse most closely monitor for during acute management of this patient? Option A. Onset of pulmonary edema. Option B. Metabolic alkalosis. Option C. Respiratory alkalosis. Option D. Parkinson's disease type symptoms. The correct answer is option A. Onset of pulmonary edema. Severe salicylate poisoning can cause increased pulmonary capillary permeability, leading to noncardiogenic pulmonary edema. Question 50. A new mother has some questions about phenylketonuria. Which of the following statements made by a nurse is not correct regarding phenylketonuria? Option A. A Guthrie test can check the necessary lab values. Option B. The urine has a high concentration of phenylpyruvic acid. Option C. Mental deficits are often present if untreated. Option D. The effects of phenylketonuria are reversible. The correct answer is option D. The effects of phenylketonuria are reversible. Neurological and cognitive damage caused by the buildup of phenylalanine in the brain is permanent and cannot be reversed, though diet can prevent further damage. Question 51. A patient's chart indicates a history of meningitis. Which of the following would you not expect to see with this patient if this condition were acute? Option A. Increased appetite. Option B. Vomiting. Option C. Fever. Option D. Poor tolerance of light. The correct answer is option A. Increased appetite. Acute meningitis presents with severe nausea, vomiting, fever, photophobia, and a stiff neck. An increased appetite would not be expected. Question 52. A patient's chart indicates a history of ketoacidosis. Which of the following would you not expect to see with this patient if this condition were acute? Option A. Vomiting. Option B. Extreme thirst. Option C. Weight gain. Option D. Acetone breath smell. The correct answer is option C. Weight gain. Diabetic ketoacidosis results in profound cellular dehydration and diuresis, leading to severe acute weight loss, not weight gain. Question 53. A patient's chart indicates a history of hyperkalemia. Which of the following would you not expect to see with this patient if this condition were acute? Option A. Decreased heart rate. Option B. Paresthesias. Option C. Muscle weakness of the extremities. Option D. Migraines. The correct answer is option D. Migraines. Hyperkalemia alters the electrical gradient of cells, causing cardiac dysrhythmias, paresthesias, and muscle weakness, but it is not directly linked to migraines. Question 54. For which of the following conditions would a nurse not administer erythromycin? Option A. Campylobacteriosis infection. Option B. Legionnaire's disease. Option C. Pneumonia. Option D. Multiple sclerosis. The correct answer is option D. Multiple sclerosis. Erythromycin is a macrolide antibiotic used to treat bacterial infections. Multiple sclerosis is an autoimmune disease, so an antibiotic is completely ineffective. Question 55. When you are taking a patient's history, she tells you she has been depressed and is dealing with an anxiety disorder. Which of the following medications would the patient most likely be taking? Option A, amitriptyline. Option B, calcitonin. Option C, pergolide mesylate. Option D, verapamil. The correct answer is option A, amitriptyline. Amitriptyline is a tricyclic antidepressant commonly prescribed for treating both clinical depression and severe anxiety disorders. Question 56. A nurse is making rounds taking vital signs. Which of the following vital signs is abnormal? Option A, 11-year-old male 90 beats per minute, 22 breaths per minute. Option B, 13-year-old female 105 beats per minute, 105 over 50 millimeters of mercury. Option C, 5-year-old male 102 beats per minute, 90 over 65 millimeters of mercury. Option D, 6-year-old female 100 beats per minute, 90 over 70 millimeters of mercury. The correct answer is option B, 13-year-old female 105 beats per minute, 105 over 50 millimeters of mercury. A diastolic pressure of 50 in a 13-year-old is considered abnormally low and presents a widened pulse pressure that warrants investigation. Question 57. A young adult is 20 years old and has been recently admitted to the hospital. According to Erickson, which of the following stages is the adult in? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame. Option D, intimacy versus isolation. The correct answer is option D, intimacy versus isolation. According to Erickson, the primary psychosocial task of young adulthood, ages 18 to 40, is forming intimate, loving relationships with other people. Question 58. A toddler is 26 months old and has been recently admitted to the hospital. According to Erickson, which of the following stages is the toddler in? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option C, autonomy versus shame and doubt. Between ages 1 and 3, toddlers are developing a greater sense of personal control, navigating the stage of autonomy versus shame and doubt. Question 59. A 5-year-old child has been recently admitted to the hospital. According to Erickson's psychosocial development stages, the child is in which stage? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option B, initiative versus guilt. Preschoolers, ages 3 to 5, assert their power and control over the world through directing play and social interaction, placing them in the initiative versus guilt stage. Question 60. A 65-year-old man has been admitted to the hospital for spinal stenosis surgery. When should the discharge training and planning begin for this patient? Option A, following surgery. Option B, upon admission. Option C, within 48 hours of discharge. Option D, preoperative discussion. The correct answer is option B, upon admission. Discharge planning must begin immediately upon admission to ensure all post-care needs, rehabilitation, and home equipment are secured in advance. Question 61. A nurse has just started her rounds delivering medication. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child does not have on any identification. What should the nurse do? Option A, contact the provider. Option B, ask the child to write their name on paper. Option C, ask a coworker about the identification of the child. Option D, ask the father who is in the room the child's name. The correct answer is option D, ask the father who is in the room the child's name. If a pediatric patient cannot state their own name, a parent or legal guardian present at the bedside serves as a reliable secondary identifier. Question 62. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Option A, gluteus maximus. Option B, gluteus minimus. Option C, vastus lateralis. Option D, vastus medialis. The correct answer is option C, vastus lateralis. The vastus lateralis is the largest, most developed muscle in infants and is the safest site for intramuscular injections to avoid nerve damage. Question 63. A parent calls the pediatric clinic and is frantic about the bottle of cleaning fluid her child drank 20 minutes ago. Which of the following is the most important instruction the nurse can give the parent? Option A. Monitor the child closely at home. Option B. Take the child immediately to the emergency room. Option C. Contact the poison control center quickly. Option D. Give the child syrup of ipecac. The correct answer is option C. Contact the poison control center quickly. The poison control center has precise, chemical-specific neutralization and management protocols. Inducing vomiting with ipecac is strictly contraindicated for corrosive cleaners. Question 64. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? Option A. The age of the child. Option B. The child's ability to understand instruction. Option C. The overall mental and physical abilities of the child. Option D. Frequent attempts with positive reinforcement. The correct answer is option C. The overall mental and physical abilities of the child. Toilet training readiness is not dictated strictly by age, but rather by the physiological sphincter control and cognitive ability to recognize the urge. Question 65. A 28-year-old male has been found wandering around in a confused pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed? Option A. Blood sugar check. Option B. Computed tomography scan. Option C. Blood cultures. Option D. Arterial blood gases. The correct answer is option A. Blood sugar check. Confusion, diaphoresis, and pallor are classic, hallmark signs of severe hypoglycemia, making a rapid blood glucose check the top priority. Question 66. A 20-year-old female attending college is found unconscious in her dorm room. She has a fever and a noticeable rash. She has just been admitted to the hospital. Which test is performed first? Option A. Blood sugar check. Option B. Computed tomography scan. Option C. Blood cultures. Option D. Arterial blood gases. The correct answer is option C. Blood cultures. A fever, rash, and altered consciousness in a young adult living in close quarters highly suggests meningococcal meningitis. Blood cultures must be drawn before starting antibiotics. Question 67. An 84-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24 hours a day, even on warm days. Which test is most likely performed? Option A. A full blood count. Option B. Electrocardiogram. Option C. Thyroid function tests. Option D. Computed tomography scan. The correct answer is option C. Thyroid function tests. Unexplained weight gain, profound lethargy, and cold intolerance are defining symptoms of hypothyroidism, requiring thyroid function testing. Question 68. A fragile 87-year-old female has recently been admitted to the hospital with increased confusion and falls over the last 2 weeks. She is also noted to have a mild left hemiparesis. Which test is most likely performed? Option A. Full blood count. Option B. Electrocardiogram. Option C. Thyroid function test. Option D. Computed tomography scan. The correct answer is option D. Computed tomography scan. Frequent falls in the elderly can cause slow-bleeding subdural hematomas. Confusion and unilateral weakness, hemiparesis, require an immediate CT scan of the head. Question 69. A nurse is reviewing a patient's chart and notices that the patient suffers from Lyme disease. Which of the following microorganisms is related to this condition? Option A. Borrelia burgdorferi. Option B. Streptococcus pyogenes. Option C. Bacillus anthracis. Option D. Enterococcus faecalis. The correct answer is option A. Borrelia burgdorferi. Lyme disease is caused by the spirochete bacterium Borrelia burgdorferi, which is transmitted to humans through the bite of infected black-legged ticks. Question 70. A nurse is reviewing a patient's chart and notices that the patient suffers from conjunctivitis. Which of the following microorganisms is related to this condition? Option A. Yersinia pestis. Option B. Helicobacter pylori. Option C. Vibrio cholerae. Option D. Haemophilus aegyptius. The correct answer is option D. Haemophilus aegyptius. Haemophilus aegyptius is a common bacterial cause of highly contagious acute epidemic purulent conjunctivitis, commonly known as pink eye. Question 71. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. Which of the following symptoms should the nurse expect the patient to exhibit? Option A, slow deep respirations. Option B, stridor. Option C, bradycardia. Option D, air hunger. The correct answer is option D, air hunger. Fluid filling the alveoli prevents oxygen exchange, leading to profound hypoxia, extreme shortness of breath, and a desperate sensation of air hunger. Question 72. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? Option A. The patient must maintain a low-calorie diet. Option B. The patient must maintain a high-protein and low-carbohydrate diet. Option C. The patient should limit sweets and sugary drinks. Option D. The patient should limit fatty foods. The correct answer is option D. The patient should limit fatty foods. The gallbladder releases bile to digest fats. Limiting dietary fat prevents gallbladder contraction, thereby preventing severe biliary colic pain. Question 73. A physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? Option A, naproxen sodium. Option B, calcium carbonate. Option C, clarithromycin. Option D, furosemide. The correct answer is option A, naproxen sodium. Naproxen is a nonsteroidal anti-inflammatory drug that severely irritates the gastric mucosa and increases the risk of dangerous gastrointestinal bleeding. Question 74. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? Option A, a history of hepatitis C 5 years previously. Option B, cholecystitis requiring cholecystectomy 1 year previously. Option C, asymptomatic diverticulosis. Option D, Crohn's disease in remission. The correct answer is option A, a history of hepatitis C 5 years previously. A history of viral hepatitis C permanently disqualifies an individual from donating blood due to the lifelong risk of transmitting the virus. Question 75. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? Option A, sexual contact with an infected partner. Option B, contaminated food. Option C, blood transfusion. Option D, illegal drug use. The correct answer is option B, contaminated food. Hepatitis A is transmitted via the fecal-oral route, most commonly through the ingestion of contaminated food or water. Question 76. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following tests assesses coagulation? Option A, partial thromboplastin time. Option B, prothrombin time. Option C, platelet count. Option D, hemoglobin. Option E, white blood cell count. The correct answers are options A and B and C, partial thromboplastin time, prothrombin time, platelet count. The liver synthesizes clotting factors. PTT, patient, and platelets all measure the body's ability to clot, which is crucial to assess before a highly vascular liver biopsy. Question 77. A nurse assigned to the emergency department evaluates a patient who underwent a fiber optic colonoscopy 18 hours previously. The patient reports increasing abdominal pain, fever, and chills. Which condition poses the most immediate concern? Option A, bowel perforation. Option B, viral gastroenteritis. Option C, colon cancer. Option D, diverticulitis. The correct answer is option A, bowel perforation. Fever, chills, and sudden increasing abdominal pain following an invasive colonoscopy are hallmark signs of peritonitis caused by a bowel perforation. Question 78. A patient with a history of diabetes mellitus is on the second post-operative day following a cholecystectomy. She complains of nausea and is not able to eat solid foods. The nurse finds the patient confused and shaky. What is the most likely explanation? Option A, anesthesia reaction. Option B, hyperglycemia. Option C, hypoglycemia. Option D, diabetic ketoacidosis. The correct answer is option C, hypoglycemia. A diabetic patient taking insulin or oral hypoglycemics who is unable to eat will rapidly develop hypoglycemia, which presents with tremors, diaphoresis, and confusion. Question 79. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? Option A. A diet high in grains. Option B. A diet with adequate caloric intake. Option C. A high-protein diet. Option D. A restricted sodium diet. The correct answer is option D. A restricted sodium diet. Addison's disease causes aldosterone deficiency, which leads to massive sodium loss in the urine. Restricting sodium is dangerous and contraindicated. Question 80. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes? Option A. Elevated serum calcium. Option B. Low serum parathyroid hormone. Option C. Elevated serum vitamin D. Option D. Low urine calcium. The correct answer is option A. Elevated serum calcium. The parathyroid glands regulate calcium. Hyperparathyroidism results in excessive hormone release, pulling calcium out of the bones and leading to elevated serum calcium levels. Question 81. A 23-year-old patient in the 27th week of pregnancy has been hospitalized on complete bed rest for 6 days. She experiences sudden shortness of breath, accompanied by chest pain. Which of the following conditions is most likely? Option A. Myocardial infarction due to atherosclerosis. Option B. Pulmonary embolism due to deep vein thrombosis. Option C. Anxiety attack due to worries about baby's health. Option D. Congestive heart failure due to overload. The correct answer is option B. Pulmonary embolism due to deep vein thrombosis. Pregnancy causes hypercoagulability, and prolonged bed rest causes venous stasis. These combined factors create a massive risk for deep vein thrombosis turning into a pulmonary embolism. Question 82. A patient who has been diagnosed with Raynaud's disease complains of cold and stiffness in the fingers. Which of the following descriptions is most likely to fit the patient? Option A. An adolescent male. Option B. An elderly woman. Option C. A young woman. Option D. An elderly man. The correct answer is option C. A young woman. Raynaud's phenomenon is a vasospastic disorder predominantly affecting the hands and feet, occurring most frequently in young, healthy women. Question 83. A nurse is providing discharge information to a patient with peripheral vascular disease. Which of the following information should be included in the instructions? Option A. Walk barefoot whenever possible. Option B. Use a heating pad to keep feet warm. Option C. Avoid crossing the legs. Option D. Use antibacterial ointment on all skin lesions. The correct answer is option C. Avoid crossing the legs. Crossing the legs heavily compresses peripheral blood vessels, further compromising already diminished arterial blood flow to the lower extremities. Question 84. Claudication is a well-known effect of peripheral vascular disease. Which of the following facts about claudication is correct? Option A. It results when oxygen demand is greater than oxygen supply. Option B. It is characterized by pain that often occurs during rest. Option C. It is a result of tissue hypoxia. Option D. It is characterized by cramping and weakness. Option E. It only affects the upper body. The correct answers are options A and C and D. It results when oxygen demand is greater than oxygen supply. It is a result of tissue hypoxia. It is characterized by cramping and weakness. Intermittent claudication is an ischemic muscle ache or cramp triggered by exercise due to inadequate arterial oxygen supply and tissue hypoxia. Question 85. A patient in the cardiac unit is concerned about the risk factors associated with atherosclerosis. Which of the following are hereditary risk factors for developing atherosclerosis? Option A. Family history of heart disease. Option B. Overweight. Option C. Smoking. Option D. Age. The correct answer is option A. Family history of heart disease. While weight and smoking are modifiable risk factors, a direct genetic family history of cardiovascular disease is a non-modifiable, hereditary risk factor. Question 86. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling of the hands and feet and cannot tolerate touch of any kind. Which is the most likely explanation for these symptoms? Option A, inadequate tissue perfusion leading to nerve damage. Option B, fluid overload leading to compression of nerve tissue. Option C, sensation distortion due to psychiatric disturbance. Option D, inflammation of the skin on the hands and feet. The correct answer is option A, inadequate tissue perfusion leading to nerve damage. Chronic lack of arterial blood supply starves peripheral nerves of oxygen, leading to ischemic neuropathy, causing severe burning, tingling, and hyperesthesia. Question 87. An infant with a hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Option A, massaging the groin area twice a day. Option B, referral to a surgeon for repair. Option C, no treatment is necessary, the fluid is reabsorbing normally. Option D, keeping the infant in a flat supine position. The correct answer is option C, no treatment is necessary, the fluid is reabsorbing normally. Most congenital hydroceles are harmless and self-resolve as the fluid slowly reabsorbs over the first year of the infant's life without intervention. Question 88. Which of the following conditions most commonly causes acute glomerulonephritis? Option A, a congenital condition leading to renal dysfunction. Option B, prior infection with group A streptococcus within the past 14 days. Option C, viral infection of the glomeruli. Option D, nephrotic syndrome. The correct answer is option B, prior infection with group A streptococcus within the past 14 days. Post-streptococcal glomerulonephritis is an immune complex disease that occurs precisely 10 to 14 days after a group A beta hemolytic strep infection of the throat or skin. Question 89. A teen patient is admitted to the hospital with a suspected diagnosis of acute glomerulonephritis. Which of the following findings is consistent with this diagnosis? Option A, urine-specific gravity of 1.040. Option B, urine output of 350 milliliters in 24 hours. Option C, brown tea-colored urine. Option D, generalized massive full-body edema. Option E, hypotension. The correct answers are options A and B and C. Urine-specific gravity of 1.040, urine output of 350 milliliters in 24 hours, brown tea-colored urine. Acute glomerulonephritis causes massive hematuria, tea-colored urine, oliguria, low output, and highly concentrated urine with a high specific gravity. Question 90. A child is admitted to the hospital with a diagnosis of Wilms tumor, stage 2. Which of the following statements most accurately describes this stage? Option A. The tumor is less than 3 centimeters in size and requires no chemotherapy. Option B. The tumor did not extend beyond the kidney and was completely resected. Option C. The tumor extended beyond the kidney but was completely resected. Option D. The tumor has spread into the abdominal cavity and cannot be resected. The correct answer is option C. The tumor extended beyond the kidney but was completely resected. In stage 2 Wilms tumor, the malignancy extends beyond the kidney capsule into surrounding local tissues, but the entire tumor can still be surgically removed. Question 91. A child has recently been diagnosed with Duchenne's muscular dystrophy. The parents are receiving genetic counseling. Which of the following statements includes the most accurate information? Option A. It is an X-linked recessive disorder, so daughters have a 50% chance of being carriers and sons a 50% chance of developing the disease. Option B. It is an X-linked recessive disorder, so both daughters and sons have a 50% chance of developing the disease. Option C. Each child has a 25% chance of developing the disorder. Option D. Sons only have a 25% chance of developing the disorder. The correct answer is option A. It is an X-linked recessive disorder, so daughters have a 50% chance of being carriers and sons a 50% chance of developing the disease. Because it is X-linked recessive, males, who have only one X chromosome, will manifest the disease if they inherit the gene, while females will become asymptomatic carriers. Question 92. A toddler has recently been diagnosed with cerebral palsy. Which of the following information should the nurse provide to the parents? Option A. Regular developmental screening is important to avoid secondary developmental delays. Option B. Cerebral palsy is caused by injury to upper motor neurons resulting in motor dysfunction. Option C. Developmental milestones may be slightly delayed but require no intervention. Option D. Parent support groups are helpful for sharing strategies and managing healthcare issues. Option E. Cerebral palsy is a progressive degenerative disease. The correct answers are options A and B and D. Regular developmental screening is important to avoid secondary developmental delays. Cerebral palsy is caused by injury to upper motor neurons resulting in motor dysfunction. Parent support groups are helpful for sharing strategies and managing healthcare issues. Cerebral palsy is a non-progressive upper motor neuron injury, making developmental screening, therapy, and family support critical for maximizing the child's potential. Question 93. A 2-year-old child has sustained an injury to the leg and refuses to walk. The nurse documents swelling of the lower affected leg. Which of the following does the nurse suspect is the cause of the child's symptoms? Option A. Possible fracture of the tibia. Option B. Bruising of the gastrocnemius muscle. Option C. Possible fracture of the radius. Option D. No anatomic injury. The child wants his mother to carry him. The correct answer is option A. Possible fracture of the tibia. Toddlers' fractures are subtle, non-displaced spiral fractures of the distal tibia that commonly present merely as swelling and a sudden refusal to bear weight. Question 94. A child is admitted several days after stepping on a sharp object that punctured her shoe and entered her foot. The physician is concerned about osteomyelitis and orders parenteral antibiotics. Which action is done immediately before the antibiotic is started? Option A. The admission orders are written. Option B. A blood culture is drawn. Option C. A complete blood count with differential is drawn. Option D. The parents arrive. The correct answer is option B. A blood culture is drawn. Blood cultures must always be drawn before the first dose of antibiotics is administered to ensure the causative organism can be correctly identified. Question 95. A nurse is assigned to the pediatric rheumatology clinic and is assessing a child diagnosed with juvenile idiopathic arthritis. Which of the following statements about the disease is most accurate? Option A. The child has a poor chance of recovery without joint deformity. Option B. Most children progress to adult rheumatoid arthritis. Option C. Nonsteroidal anti-inflammatory drugs are the first choice in treatment. Option D. Physical activity should be minimized. The correct answer is option C. Nonsteroidal anti-inflammatory drugs are the first choice in treatment. NSAIDs are the foundation and first line of pharmacological therapy for reducing pain and managing the joint inflammation associated with juvenile idiopathic arthritis. Question 96. A clinic nurse interviews a parent who is suspected of abusing her child. Which of the following characteristics is the nurse least likely to find in an abusing parent? Option A. Low self-esteem. Option B. Unemployment. Option C. Self-blame for the injury to the child. Option D. Single status. The correct answer is option C. Self-blame for the injury to the child. Abusive parents generally lack remorse and project the blame for injuries onto the child, a sibling, or an unavoidable accident, rather than accepting self-blame. Question 97. The clinic nurse asks a 13-year-old female to bend forward at the waist with arms hanging freely. Which of the following assessments is the nurse most likely conducting? Option A. Spinal flexibility. Option B. Leg length disparity. Option C. Hypostatic blood pressure. Option D. Scoliosis. The correct answer is option D. Scoliosis. The Adams Forward Bend Test is the standard non-invasive physical assessment technique used in schools and clinics to screen for spinal curvature indicating scoliosis. Question 98. An adolescent brings a physician's note to school stating that he is not to participate in sports due to a diagnosis of Osgood-Schlatter disease. Which of the following statements about the disease is correct? Option A. The condition was caused by the student's competitive swimming schedule. Option B. The student will most likely require surgical intervention. Option C. The student experiences pain in the inferior aspect of the knee. Option D. The student is trying to avoid participation in physical education. The correct answer is option C. The student experiences pain in the inferior aspect of the knee. Osgood-Schlatter disease is an inflammation of the patellar ligament at the tibial tuberosity, causing painful swelling just beneath the knee, common in growing adolescents. Question 99. An infant is brought to the clinic by his mother, who has noticed that he holds his head in an unusual position and always faces to one side. Which of the following is the most likely explanation? Option A, torticollis with shortening of the sternocleidomastoid muscle. Option B, craniosynostosis with premature closure of the cranial sutures. Option C, plagiocephaly with flattening of one side of the head. Option D, hydrocephalus with increased head size. The correct answer is option A, torticollis with shortening of the sternocleidomastoid muscle. Congenital torticollis results from a unilateral contracture or shortening of the sternocleidomastoid muscle, pulling the infant's head to one side. Question 100. Thrombolytic therapy is frequently used in the treatment of suspected stroke. Which of the following is a significant complication associated with thrombolytic therapy? Option A, air embolus. Option B, cerebral hemorrhage. Option C, expansion of the clot. Option D, resolution of the clot. The correct answer is option B, cerebral hemorrhage. Thrombolytics are powerful clot busters. Converting an ischemic stroke into a fatal hemorrhagic stroke is the most dangerous and significant complication. Question 101. A client has an order for streptokinase. Before administering the medication, the nurse should assess the client for Option A, allergies to pineapples and bananas. Option B, a history of streptococcal infections. Option C, prior therapy with phenytoin. Option D, a history of alcohol abuse. The correct answer is option B, a history of streptococcal infections. Streptokinase is derived from Streptococcus bacteria. Patients with a recent strep infection may have antibodies that neutralize the drug or cause severe allergic anaphylaxis. Question 102. The nurse is assisting the physician with the removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to Option A, perform the Valsalva maneuver as the catheter is advanced. Option B, turn his head to the left side and hyperextend the neck. Option C, take slow deep breaths as the catheter is removed. Option D, turn his head to the right while maintaining a sniffing position. The correct answer is option A, perform the Valsalva maneuver as the catheter is advanced. Performing the Valsalva maneuver increases intrathoracic pressure, which absolutely prevents air from being sucked into the vein and causing a fatal air embolism. Question 103. A client is discharged home with a prescription for sodium warfarin. The client should be instructed to Option A, have a ProTime done monthly. Option B, eat more fruits and vegetables. Option C, drink more liquids. Option D, avoid crowds. The correct answer is option A, have a ProTime done monthly. Warfarin has a narrow therapeutic index. Patients require frequent, regular prothrombin time, patient, and INR blood tests to adjust the dosage and prevent life-threatening bleeding. Question 104. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating Option A, packaged fruits. Option B, salt. Option C, fresh raw pepper. Option D, ketchup. The correct answer is option C, fresh raw pepper. Fresh, raw vegetables and unpasteurized spices like raw black pepper carry high amounts of environmental bacteria and fungi, which are dangerous for a neutropenic patient. Question 105. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure the doctor will remove the Option A, head of the pancreas. Option B, proximal third section of the small intestines. Option C, stomach and duodenum. Option D, esophagus and jejunum. The correct answer is option A, head of the pancreas. A standard pancreaticoduodenectomy, Whipple procedure, involves the surgical removal of the head of the pancreas, the duodenum, the gallbladder, and the bile duct. Question 106. A client who is admitted with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response by the nurse indicates an understanding of phantom limb pain? Option A, the pain will go away in a few days. Option B, the pain is due to peripheral nervous system interruptions. Option C, The pain is psychological because your foot is no longer there. Option D. The pain and itching are due to the infection you had before the surgery. The correct answer is option B. The pain is due to peripheral nervous system interruptions. Phantom limb pain is a very real neurological phenomenon caused by the severing of peripheral nerve pathways, sending confused signals to the brain. Question 107. A client hospitalized with methicillin-resistant Staphylococcus aureus is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? Option A. The client should be placed in a room with negative pressure. Option B. Infection requires close contact, therefore the door may remain open. Option C. Transmission is highly likely, so the client should wear a mask at all times. Option D. Infection is prevented by hand washing, gloves, and a gown. The correct answer is option D. Infection is prevented by hand washing, gloves, and a gown. Contact precautions require the use of standard personal protective equipment, gloves and gowns, to prevent the physical transfer of microorganisms from skin or surfaces. Question 108. During a home visit, a client with acquired immunodeficiency syndrome tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Option A. Administer an antibiotic. Option B. Contact the physician for an order for immune globulin. Option C. Administer an antiviral. Option D. Tell the client that he should remain in isolation for 2 weeks. The correct answer is option B. Contact the physician for an order for immune globulin. Immunocompromised patients cannot mount a response to a vaccine, so they must be given preformed antibodies, immune globulin, immediately after exposure for passive immunity. Question 109. A client recently started on hemodialysis wants to know how the dialysis will take the place of his kidneys. The nurse's response is based on the knowledge that hemodialysis works by option A. Passing water through a dialysing membrane. Option B. Eliminating plasma proteins from the blood. Option C. Lowering the pH by removing non-volatile acids. Option D. Filtering waste through a dialysing membrane. The correct answer is option D. Filtering waste through a dialysing membrane. Hemodialysis relies on osmosis and diffusion to pull toxic waste products and excess fluid from the blood across a semi-permeable dialysing membrane. Question 110. The primary reason for rapid continuous revarming of the area affected by frostbite is to option A. Lessen the amount of cellular damage. Option B. Prevent the formation of blisters. Option C. Promote movement. Option D. Prevent pain and discomfort. The correct answer is option A. Lessen the amount of cellular damage. Rapid, continuous revarming in a warm water bath halts the freezing process instantly, preventing further tissue necrosis and minimizing permanent cellular damage. Question 111. A client with a clotting disorder has an order to continue enoxaparin injections after discharge. The nurse should teach the client that enoxaparin should, option A, be injected into the deltoid muscle. Option B. Be injected into the abdomen. Option C. Be aspirated after the injection. Option D. Be cleared of air from the syringe before injections. The correct answer is option B. Be injected into the abdomen. Enoxaparin, Lovenox, is a low molecular weight heparin that must be administered strictly via deep subcutaneous injection into the fatty tissue of the abdomen. Question 112. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a non-stress test can be ordered for this client to option A. Determine lung maturity. Option B. Measure the fetal activity. Option C. Show the effect of contractions on fetal heart rate. Option D. Measure the well-being of the fetus. The correct answer is option D. Measure the well-being of the fetus. A non-stress test is a non-invasive monitor of the fetal heart rate in response to fetal movement, universally used as a primary indicator of fetal well-being. Question 113. A toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will option A. Tire easily. Option B. Grow normally. Option C. Need more calories. Option D. Be more susceptible to viral infections. The correct answer is option A. Tire easily. A ventricular septal defect forces oxygenated blood back into the lungs, increasing cardiac workload and causing the infant to tire very easily, especially during feeding. Question 114. The infant is admitted to the unit with tetralogy of Fallot. The nurse would anticipate an order for which medication? Option A, digoxin. Option B, epinephrine. Option C, aminophylline. Option D, atropine. The correct answer is option A, digoxin. Digoxin is a cardiac glycoside that increases the force of myocardial contraction while slowing the heart rate, improving overall cardiac efficiency in structural heart defects. Question 115. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 milliliters. The nurse should give priority to option A, turning the client to the left side. Option B, milking the tube to ensure patency. Option C, slowing the intravenous infusion. Option D, notifying the physician. The correct answer is option D, notifying the physician. Chest tube drainage exceeding 100 milliliters per hour is abnormal and indicates active surgical hemorrhage, requiring immediate notification of the surgeon. Question 116. The nurse is changing the ties of a client with a tracheotomy. The safest method of changing the tracheotomy ties is to option A, apply the new tie before removing the old one. Option B, have a helper present. Option C, hold the tracheotomy with the non-dominant hand while removing the old tie. Option D, ask the doctor to suture the tracheostomy in place. The correct answer is option A, apply the new tie before removing the old one. Securing the new tie before detaching the old one guarantees that the tracheostomy tube cannot be accidentally coughed out during the procedure. Question 117. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid option A, using oil or cream-based soaps. Option B, flossing between the teeth. Option C, the intake of salt. Option D, using an electric razor. The correct answer is option B, flossing between the teeth. Leukemia causes profound thrombocytopenia. Flossing can easily traumatize fragile gingival tissue, causing severe, uncontrollable oral bleeding. Question 118. Which of the following positions would best aid breathing for a patient with acute pulmonary edema? Option A, lying flat in bed. Option B, left side lying position. Option C, high Fowler's position. Option D, semi-Fowler's position. The correct answer is option C, high Fowler's position. High Fowler's position, sitting straight up at 90 degrees, relies on gravity to pool fluid in the lung bases, freeing up the upper airways for vital oxygen exchange. Question 119. Which of the following interventions should be your first priority when treating a patient experiencing chest pain while walking? Option A, have the patient sit down. Option B, get the patient back to bed. Option C, obtain an electrocardiogram. Option D, administer sublingual nitroglycerin. The correct answer is option A, have the patient sit down. The immediate priority during an angina attack is to drastically reduce myocardial oxygen demand by immediately ceasing all physical activity and having the patient sit down. Question 120. In which of the following types of cardiomyopathy does cardiac output remain normal? Option A, dilated. Option B, hypertrophic. Option C, obliterative. Option D, restrictive. The correct answer is option B, hypertrophic. In hypertrophic cardiomyopathy, the heart muscle thickens significantly. Although filling space is reduced, the powerful contractions initially maintain a normal cardiac output. Question 121. Which of the following signs and symptoms usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? Option A, abdominal pain. Option B, absent pedal pulses. Option C, chest pain. Option D, lower back pain. The correct answer is option D, lower back pain. Sudden, severe, tearing lower back pain indicates that an abdominal aortic aneurysm is rapidly expanding and pressing against the lumbar spinal nerves just prior to rupture. Question 122. What is the first intervention for a patient experiencing chest pain and an oxygen saturation of 89%? Option A, administer morphine. Option B, administer oxygen. Option C, administer sublingual nitroglycerin. Option D, obtain an electrocardiogram. The correct answer is option B, administer oxygen. Oxygen is the most critical immediate intervention when saturation falls below 94%, especially during ischemic chest pain, to prevent myocardial tissue death. Question 123. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by option A, cats, option B, dogs, option C, turtles, option D, birds. The correct answer is option D, birds. Histoplasmosis is a fungal infection caused by inhaling spores found heavily concentrated in soil contaminated by bird and bat droppings. Question 124. The client has recently returned from having a thyroidectomy. The nurse should keep which of the following at the bedside? Option A, a tracheotomy set. Option B, a padded tongue blade. Option C, an endotracheal tube. Option D, an airway. The correct answer is option A, a tracheotomy set. Post-thyroidectomy swelling, hemorrhage, or laryngeal nerve damage can cause a sudden, total airway collapse, requiring an immediate emergency tracheotomy. Question 125. Which task should be assigned to the nursing assistant? Option A, placing the client in seclusion. Option B, emptying the Foley catheter of the preeclamptic client. Option C, feeding the client with dementia. Option D, ambulating the client with a fractured hip. The correct answer is option C, feeding the client with dementia. Feeding a stable patient with dementia is a routine, standard task that falls within the established scope of practice for unlicensed assistive personnel. Question 126. A client with frequent urinary tract infections asks the nurse how she can prevent the reoccurrence. The nurse should teach the client to: option A, douche after intercourse. Option B, void every 3 hours. Option C, obtain a urinalysis monthly. Option D, wipe from back to front after voiding. The correct answer is option B, void every 3 hours. Frequent voiding flushes bacteria out of the urethra before they have a chance to migrate upward and establish a bladder infection. Question 127. The nurse has a preoperative order to administer diazepam 10 mg and promethazine 25 mg. The correct method of administering these medications is to: option A, administer the medications together in one syringe. Option B, administer the medications separately. Option C, administer the diazepam, wait 5 minutes, and then inject the promethazine. Option D, question the order because they cannot be given at the same time. The correct answer is option B, administer the medications separately. Diazepam is notoriously incompatible with almost all other medications and will precipitate instantly in a syringe, so it must be administered completely separately. Question 128. Which of the following signs of increased intracranial pressure would appear first after head trauma? Option A, bradycardia. Option B, large amounts of very dilute urine. Option C, restlessness and confusion. Option D, widened pulse pressure. The correct answer is option C, restlessness and confusion. Changes in the level of consciousness, such as subtle restlessness or confusion, are the absolute earliest indicators of rising pressure inside the skull. Question 129. Which of the following nursing interventions should you use to prevent foot drop and contractures in a patient recovering from a subdural hematoma? Option A, high-top sneakers. Option B, low-dose heparin therapy. Option C, physical therapy consultation. Option D, sequential compression devices. The correct answer is option A, high-top sneakers. High-top sneakers effectively hold the ankle in a neutral, anatomic position, physically preventing the Achilles tendon from shortening and causing foot drop. Question 130. Which of the following measures best determines that a patient who had a pneumothorax no longer needs a chest tube? Option A, you see a lot of drainage from the chest tube. Option B, arterial blood gas levels are normal. Option C, the chest X-ray continues to show the lung is 35% deflated. Option D, the water seal chamber does not fluctuate when no suction is applied. The correct answer is option D, the water seal chamber does not fluctuate when no suction is applied. Cessation of titling, fluctuation, in the water seal chamber indicates that the pleural space has fully healed and re-expanded against the chest wall. Question 131. A firefighter who was involved in extinguishing a house fire is being treated for smoke inhalation. He develops severe hypoxia 48 hours later. Which condition has he most likely developed? Option A, acute respiratory distress syndrome. Option B, atelectasis. Option C, bronchitis. Option D, pneumonia. The correct answer is option A, acute respiratory distress syndrome. Thermal injury and toxic smoke inhalation severely damage the alveolar capillary membrane, triggering massive fluid leakage and classic acute respiratory distress syndrome. Question 132. A 19-year-old patient comes to the emergency department with acute asthma. His respiratory rate is 44 breaths per minute. Which action should you take first? Option A, take a full medical history. Option B, give a bronchodilator by nebulizer. Option C, apply a cardiac monitor to the patient. Option D, provide emotional support for the patient. The correct answer is option B, give a bronchodilator by nebulizer. In an acute asthma attack, the smooth muscles of the airway are in severe spasm. A fast-acting bronchodilator is the only intervention that will immediately open the airway. Question 133. A 20-year-old patient is being treated for pneumonia. He has a persistent cough and complains of severe pain on coughing. What could you tell him to help reduce his discomfort? Option A, hold your cough as much as possible. Option B, place the head of your bed flat to help with coughing. Option C, restrict fluid to help decrease the amount of sputum. Option D, splint your chest wall with a pillow for comfort. The correct answer is option D, splint your chest wall with a pillow for comfort. Pressing a firm pillow against the chest wall during a cough stabilizes the ribcage, drastically reducing the muscular stretch and resulting pain. Question 134. A patient infected with human immunodeficiency virus begins zidovudine therapy. Which of the following statements best describes this drug's action? Option A, it destroys the outer wall of the virus and kills it. Option B, it interferes with viral replication. Option C, it stimulates the immune system. Option D, it promotes excretion of viral antibodies. The correct answer is option B, it interferes with viral replication. Zidovudine is a nucleoside reverse transcriptase inhibitor that specifically blocks the enzyme the virus requires to replicate its RNA into human DNA. Question 135. Corticosteroids are potent suppressors of the body's inflammatory response. Which of the following conditions or actions do they suppress? Option A, Cushing syndrome. Option B, pain receptors. Option C, immune response. Option D, neural transmission. The correct answer is option C, immune response. Corticosteroids directly inhibit leukocyte function and inflammatory mediators, thereby profoundly suppressing the entire human immune response. Question 136. A 16-year-old patient involved in a motor vehicle accident arrives unconscious and severely hypotensive. He is suspected to have several fractures. Which parenteral fluid is best? Option A, fresh frozen plasma. Option B, 0.9% sodium chloride solution. Option C, lactate Ringer's solution. Option D, packed red blood cells. The correct answer is option D, packed red blood cells. Severe hypotension combined with massive internal fracture trauma indicates profound hemorrhagic blood loss, requiring immediate volume and oxygen-carrying replacement via red blood cells. Question 137. A pregnant woman arrives at the emergency department with abruptio placentae at 34 weeks gestation. She is at risk for which of the following blood dyscrasias? Option A, thrombocytopenia. Option B, idiopathic thrombocytopenic purpura. Option C, disseminated intravascular coagulation. Option D, heparin-associated thrombosis and thrombocytopenia. The correct answer is option C, disseminated intravascular coagulation. Placental abruption releases massive amounts of tissue thromboplastin into the mother's circulation, triggering the chaotic, life-threatening clotting cycle of Dick. Question 138. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Option A, thoroughly irrigate the wound before collecting the sputum. Option B, use a sterile swab and wipe the crusty area around the outside of the wound. Option C, gently roll a sterile swab from the center of the wound outward. Option D. Use a sterile swab to collect drainage from the dressing. The correct answer is option C. Gently roll a sterile swab from the center of the wound outward. Rolling from the center outward ensures the sample captures the active bacterial growth within the wound bed rather than normal skin flora from the edges. Question 139. A patient has partial thickness burns to both legs and portions of his trunk. Which of the following intravenous fluids is given first? Option A. Albumin. Option B. Dextrose 5% in water. Option C. Lactate Ringer's solution. Option D. 0.9% sodium chloride solution with potassium. The correct answer is option C. Lactate Ringer's solution. Lactate Ringer's is an isotonic crystalloid whose composition most closely mimics human blood plasma, making it the gold standard for fluid resuscitation in major burns. Question 140. On a follow-up visit after having a vaginal hysterectomy, a 32-year-old patient has a decreased hematocrit level. Which of the following complications does this suggest? Option A. Hematoma. Option B. Hypovolemia. Option C. Infection. Option D. Pulmonary embolus. The correct answer is option A. Hematoma. A dropping hematocrit level following pelvic surgery strongly suggests an occult, slow internal hemorrhage pooling as a hematoma. Question 141. Patients with type 1 diabetes mellitus may require which of the following changes to their daily routine during periods of infection? Option A. No changes. Option B. Less insulin. Option C. More insulin. Option D. Oral diabetic agents. The correct answer is option C. More insulin. Physiological stress from an infection releases massive amounts of cortisol and epinephrine, driving blood glucose severely high and necessitating more insulin. Question 142. Adequate fluid replacement and vasopressin replacement are objectives of therapy for which of the following disease processes? Option A. Diabetes mellitus. Option B. Diabetes insipidus. Option C. Diabetic ketoacidosis. Option D. Syndrome of inappropriate antidiuretic hormone. The correct answer is option B. Diabetes insipidus. Diabetes insipidus results from a lack of antidiuretic hormone, causing massive water loss. Treatment strictly requires replacing fluids and the missing hormone, vasopressin. Question 143. Which of the following potentially serious complications could occur with therapy for hypothyroidism? Option A. Acute hemolytic reaction. Option B. Angina or cardiac arrhythmia. Option C. Retinopathy. Option D. Thrombocytopenia. The correct answer is option B. Angina or cardiac arrhythmia. Thyroid replacement medications speed up the basal metabolic rate. If the dose is too high, it overly stimulates the heart, causing dangerous ischemia and arrhythmias. Question 144. After a liver biopsy, place the patient in which of the following positions? Option A. Left side lying with the bed flat. Option B. Right side lying with the bed flat. Option C. Left side lying with the bed in semi-Fowler's position. Option D. Right side lying with the bed in semi-Fowler's position. The correct answer is option B. Right side lying with the bed flat. The liver is on the right side of the body. Positioning the patient flat on their right side uses their own body weight to apply direct pressure and prevent lethal hemorrhage. Question 145. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis? Option A. Nutrition management. Option B. Fluid and electrolyte balance. Option C. Management of hypoglycemia. Option D. Pain control. The correct answer is option B. Fluid and electrolyte balance. Acute pancreatitis causes massive systemic inflammation and capillary leak, leading to profound hypovolemic shock. Fluid and electrolyte resuscitation is the absolute life-saving priority. Question 146. After surgical repair of a hip, which of the following positions is best for the patient's legs and hips? Option A. Abduction. Option B. Adduction. Option C. Prone. Option D. Subluxated. The correct answer is option A. Abduction. Keeping the legs abducted, spread apart, using an abductor pillow prevents the newly placed hip prosthesis from popping out of the joint capsule. Question 147. When giving intravenous phenytoin, which of the following methods should you use? Option A. Use an inline filter. Option B. Withhold other anticonvulsants. Option C. Mix the drug with saline solution only. Option D. Flush the intravenous catheter with dextrose solution. The correct answer is option C. Mix the drug with saline solution only. Phenytoin is highly unstable and will immediately crystallize and occlude the intravenous line if mixed with any solution containing dextrose. It must only be mixed with normal saline. Question 148. A hospitalized patient is receiving packed red blood cells for treatment of severe anemia. Which of the following is the most accurate statement? Option A. Transfusion reaction is most likely immediately after the infusion is completed. Option B. Red blood cells are best infused slowly through a 20-gauge catheter. Option C. Red blood cells should be flushed with a 5% dextrose solution. Option D. A nurse should remain in the room during the first 15 minutes of infusion. The correct answer is option D. A nurse should remain in the room during the first 15 minutes of infusion. Most severe, life-threatening ABO incompatibility transfusion reactions occur within the very first 15 minutes, requiring the nurse's direct presence and constant monitoring. Question 149. A clinic patient has a hemoglobin concentration of 10.8 grams per deciliter and reports sticking to a strict vegetarian diet. Which of the following nutritional advice is appropriate? Option A. The diet is providing adequate sources of iron and requires no changes. Option B. The patient should add meat to her diet. Option C. The patient should use iron cookware to prepare foods. Option D. A cup of coffee or tea should be added to every meal. The correct answer is option C. The patient should use iron cookware to prepare foods. Cooking highly acidic or moisture-rich foods in cast iron skillets physically leaches dietary iron into the food, providing an excellent supplement for vegetarians. Question 150. A patient received surgery and chemotherapy for colon cancer. At a follow-up appointment, she complains of fatigue and difficulty with concentration. Which is the most likely explanation? Option A. The symptoms may be the result of anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be the result of anemia caused by chemotherapy. Chemotherapy is highly toxic to rapidly dividing bone marrow cells, frequently resulting in profound, lingering anemia that causes fatigue and poor concentration. Question 151. A clinic patient has recently been prescribed nitroglycerin for treatment of angina. He calls the nurse complaining of frequent headaches. Which of the following responses is correct? Option A. Stop taking the nitroglycerin and see if the headaches improve. Option B. Go to the emergency department because nitroglycerin causes brain bleeding. Option C. Headaches are a frequent side effect of nitroglycerin because it causes vasodilation. Option D. The headaches are unlikely to be related to the nitroglycerin. The correct answer is option C. Headaches are a frequent side effect of nitroglycerin because it causes vasodilation. Nitroglycerin works by rapidly dilating all blood vessels. The sudden dilation of cerebral vessels frequently causes pounding, throbbing headaches. Question 152. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions should the nurse perform first? Option A. Ask the patient to lie down on the exam table. Option B. Draw blood for a chemistry panel and arterial blood gas. Option C. Send the patient for a chest X-ray. Option D. Check blood pressure. The correct answer is option D. Check blood pressure. Taking vital signs, specifically blood pressure, provides immediate, baseline physiological data to determine the severity of the heart failure exacerbation. Question 153. A patient arrives in the emergency department with symptoms of myocardial infarction, progressing to cardiogenic shock. Which of the following symptoms should the nurse expect? Option A. Hypertension. Option B. Bradycardia. Option C. Bounding pulse. Option D. Confusion. The correct answer is option D. Confusion. Cardiogenic shock causes a massive drop in cardiac output. The brain immediately suffers from hypoperfusion and hypoxia, resulting in rapid confusion and altered mental status. Question 154. Following a myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises and ambulate. Which of the following reflects the purpose of exercise? Option A, increases fitness and prevents future heart attacks. Option B, prevents bed sores. Option C, prevents deep vein thrombosis. Option D, prevents constipation. The correct answer is option C, prevents deep vein thrombosis. Prolonged bed rest causes blood to pool in the lower extremities, venous stasis. Early ambulation physically pumps the blood back to the heart, preventing deep vein thrombosis. Question 155. Tissue plasminogen activator is considered for treatment of a patient with myocardial infarction. Which of the following is a contraindication for treatment? Option A, worsening chest pain that began earlier in the evening. Option B, history of cerebral hemorrhage. Option C, history of prior myocardial infarction. Option D, hypertension. The correct answer is option B, history of cerebral hemorrhage. Thrombolytics completely dissolve clots system-wide. A history of cerebral hemorrhage is an absolute contraindication as it carries a massive risk of rebleeding in the brain. Question 156. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Option A, obesity. Option B, heredity. Option C, gender. Option D, age. The correct answer is option A, obesity. Unlike genetics, gender, and age, a patient has the power to modify, treat, and completely change their weight and obesity status through diet and exercise. Question 157. A nurse is administering intravenous furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected? Option A, increased urinary output. Option B, decreased edema. Option C, decreased pain. Option D, decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a potent loop diuretic that pulls fluid out of the body, lowering blood pressure and edema. It has zero analgesic properties, so decreased pain is not expected. Question 158. A patient is about to undergo a bone marrow aspiration and expresses fear and anxiety. Which of the following is the most effective nursing response? Option A, warn the patient to stay very still because movement increases pain. Option B, encourage the family to stay in the room for the procedure. Option C, stay with the patient and focus on slow deep breathing for relaxation. Option D, delay the procedure to allow the patient to deal with her feelings. The correct answer is option C, stay with the patient and focus on slow deep breathing for relaxation. Guided deep breathing effectively lowers the heart rate, mitigates the panic response, and builds a trusting therapeutic relationship during a painful procedure. Question 159. A patient with Hodgkin's disease underwent a lymph node biopsy. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Option A, Reed-Sternberg cells. Option B, lymphoblastic cells. Option C, Gaucher cells. Option D, Reeder cells. The correct answer is option A, Reed-Sternberg cells. The absolute definitive diagnostic hallmark of Hodgkin's lymphoma is the microscopic presence of giant, abnormal, binucleated lymphocytes known as Reed-Sternberg cells. Question 160. A patient is admitted to the oncology unit for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Option A, painful cervical lymph nodes. Option B, night sweats and fatigue. Option C, nausea and vomiting. Option D, weight gain. The correct answer is option B, night sweats and fatigue. The classic B symptoms of systemic lymphomas include profound fatigue, unexplained weight loss, fever, and drenching night sweats. Question 161. A nurse is caring for a patient with acute lymphoblastic leukemia. Which of the following is the most likely age range of the patient? Option A, 3 to 10 years. Option B, 25 to 35 years. Option C, 45 to 55 years. Option D, over 60 years. The correct answer is option A, 3 to 10 years. Acute lymphoblastic leukemia is the most common childhood cancer, peaking significantly in incidence between the ages of 2 and 5 years old. Question 162. A patient is undergoing treatment for leukemia. The nurse teaches the family about infectious precautions. Which statement indicates the family needs more education? Option A. We will bring in books and magazines for entertainment. Option B. We will bring in personal care items for comfort. Option C. We will bring in fresh flowers to brighten the room. Option D. We will bring in family pictures and get well cards. The correct answer is option C. We will bring in fresh flowers to brighten the room. Leukemia treatment severely suppresses the immune system. Fresh flowers and stagnant water harbor lethal fungi and bacteria, making them strictly forbidden in neutropenic rooms. Question 163. A client who has facial drooping, a weak cough, and decreased gag reflex is admitted for treatment. Which of the following actions should the nurse implement first? Option A. Complete the Glasgow Coma Scale. Option B. Provide a communication board. Option C. Consult a speech-language pathologist. Option D. Auscultate lung sounds. The correct answer is option D. Auscultate lung sounds. A weak cough and absent gag reflex put the patient at extreme risk for aspiration. Auscultating the lungs immediately identifies if fluid or food has already entered the airway. Question 164. A nurse cares for a client who is 1 hour post-vaginal delivery. Which of the following findings is an early sign of postpartum hemorrhage? Option A. Shallow rapid respirations. Option B. Petechiae. Option C. Increasing heart rate. Option D. Lethargy. The correct answer is option C. Increasing heart rate. As the body rapidly loses blood volume, the heart immediately compensates by beating faster, tachycardia, to try and maintain cardiac output and blood pressure. Question 165. A nurse administers 8 units of regular insulin to a client at 0730. What time is this client most at risk for hypoglycemia? Option A 0700. Option B 0800. Option C 1000. Option D 1430. The correct answer is option C, 1000. Regular insulin is a short-acting insulin that hits its absolute peak action and greatest risk for plunging blood sugar, approximately 2 to 3 hours after administration. Question 166. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? Option A. Change the disposable mask immediately. Option B. Change gloves immediately after use. Option C. Minimize patient contact. Option D. Minimize patient conversation. The correct answer is option B. Change gloves immediately after use. Meticulous hand hygiene and immediate glove changing after touching any contaminated surface are the most effective ways to prevent transferring lethal infections to a neutropenic patient. Question 167. A nurse in the emergency department assesses a patient taking long-term corticosteroids. Which of the following is a typical side effect of corticosteroid treatment? Option A. Hypertension. Option B. Cushing's triad. Option C. Hyponatremia. Option D. Low serum albumin. Option E. Weight loss. The correct answers are options A and B and D. Hypertension, Cushing's triad, low serum albumin. Long-term corticosteroid use fundamentally alters metabolism, leading to fluid retention, severe hypertension, fat redistribution, Cushing's appearance, and protein depletion. Question 168. A nurse is caring for a patient with a platelet count of 20,000 per microliter. Which of the following is an important intervention? Option A. Observe for evidence of spontaneous bleeding. Option B. Limit visitors to family only. Option C. Give aspirin in case of headaches. Option D. Impose immune precautions. The correct answer is option A. Observe for evidence of spontaneous bleeding. A platelet count below 20,000 puts the patient at imminent risk for massive, unprovoked spontaneous hemorrhage, requiring intense monitoring. Question 169. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Option A. Weight loss. Option B. Increased clotting time. Option C. Hypertension. Option D. Headaches. Option E. Bradycardia. The correct answers are options B and C and D. Increased clotting time, hypertension, headaches. Polycythemia vera produces massive amounts of red blood cells, turning the blood thick and viscous. This directly causes severe hypertension, headaches, and a risk for clotting. Question 170. A patient who has received chemotherapy for cancer treatment is given an injection of epoetin. Which of the following should reflect the findings in a complete blood count drawn several days later? Option A. An increase in neutrophil count. Option B. An increase in hematocrit. Option C. An increase in platelet count. Option D. An increase in serum iron. The correct answer is option B. An increase in hematocrit. Epoetin alpha is a synthetic version of human erythropoietin, which directly stimulates the bone marrow to produce red blood cells, thus raising the hematocrit. Question 171. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Option A. Blood pressure 146/88. Option B. Respirations 28 and shallow. Option C. Weight gain of 10 pounds in 6 months. Option D. Pink complexion. The correct answer is option B. Respirations 28 and shallow. Anemia means the blood lacks oxygen carrying capacity. The body compensates for tissue hypoxia by breathing faster, tachypnea, to pull more oxygen into the lungs. Question 172. An African American female comes to the clinic. The physician suspects vitamin B12 deficiency anemia. Because jaundice is often a clinical manifestation, what body part would be the best indicator? Option A. Conjunctiva of the eye. Option B. Soles of the feet. Option C. Roof of the mouth. Option D. Shins. The correct answer is option C. Roof of the mouth. In heavily pigmented individuals, the hard palate, roof of the mouth, and the sclera of the eyes are the most reliable locations to observe the yellow discoloration of jaundice. Question 173. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Option A. Palpate the spleen. Option B. Take the blood pressure. Option C. Examine the feet for petechiae. Option D. Examine the tongue. The correct answer is option D. Examine the tongue. A classic, definitive physical finding of severe vitamin B12 deficiency, pernicious anemia, is a smooth, thick, beefy red, and painful tongue, glossitis. Question 174. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? Option A. A family vacation in the Rocky Mountains. Option B. Chaperoning the local boys' club on a snow skiing trip. Option C. Traveling by airplane for business trips. Option D. A bus trip to the Museum of Natural History. The correct answer is option D. A bus trip to the Museum of Natural History. A low-stress bus trip avoids high altitudes, extreme cold, and unpressurized cabins, all of which are severe triggers that cause red blood cells to sickle. Question 175. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? Option A. Roast beef, gelatin salad, green beans, and peach pie. Option B. Chicken salad sandwich, coleslaw, French fries, ice cream. Option C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Option D. Pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Eggs, whole wheat bread, dark leafy lettuce, and raisins are all exceptionally excellent dietary sources of natural iron. Question 176. A newly admitted client has sickle cell crisis and is complaining of severe pain in his feet and hands. The pulse oximetry is 92. Which intervention is implemented first? Option A. Adjust the room temperature. Option B. Give a bolus of intravenous fluids. Option C. Start oxygen. Option D. Administer meperidine 75 mg intravenous push. The correct answer is option C. Start oxygen. Sickling is directly caused by a lack of oxygen. Applying supplemental oxygen immediately reverses hypoxia and stops further cells from sickling. Question 177. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Option A, peaches. Option B, cottage cheese. Option C, popsicle. Option D, lima beans. The correct answer is option C, popsicle. Dehydration rapidly accelerates the sickling of red blood cells. A popsicle provides an easy, highly palatable source of immediate fluid hydration. Question 178. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Option A. Take hourly blood pressures with mechanical cuff. Option B. Encourage fluid intake of at least 200 milliliters per hour. Option C. Position in high Fowlers with knee gauge raised. Option D. Administering Tylenol as ordered. The correct answer is option B. Encourage fluid intake of at least 200 milliliters per hour. Massive intravenous and oral fluid hydration hemodilutes the blood, physically washing out the sticky, sickled cells that are clogging the capillaries. Question 179. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Option A. Side lying with knees flexed. Option B. Knee chest. Option C. High Fowlers with knees flexed. Option D. Semi Fowlers with legs extended on the bed. The correct answer is option D. Semi Fowlers with legs extended on the bed. Keeping the legs fully extended promotes maximal venous return and arterial blood flow. Flexing the knees cuts off circulation and worsens the painful ischemic crisis. Question 180. A 43-year-old African American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities. Which outcome criteria would the nurse use? Option A. Body temperature of 99 degrees Fahrenheit or less. Option B. Toes moved in active range of motion. Option C. Sensation reported when soles of feet are touched. Option D. Capillary refill of less than 3 seconds. The correct answer is option D. Capillary refill of less than 3 seconds. Capillary refill is the gold standard, objective measurement of how well arterial blood is successfully perfusing the distal tissues. Question 181. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention of this client is: Option A. Measure the urinary output. Option B. Check the vital signs. Option C. Encourage increased fluid intake. Option D. Weigh the client. The correct answer is option B. Check the vital signs. Diabetes insipidus causes massive, rapid fluid loss. Checking vital signs immediately identifies if the patient has crashed into deadly hypovolemic shock. Question 182. A client with a pituitary tumor has had a transsphenoidal hypophysectomy. Which of the following interventions would be appropriate for this client? Option A. Place the client in Trendelenburg position for postural drainage. Option B. Encourage coughing and deep breathing every 2 hours. Option C. Elevate the head of the bed 30 degrees. Option D. Encourage the Valsalva maneuver for bowel movements. The correct answer is option C. Elevate the head of the bed 30 degrees. The surgery breaches the floor of the skull. Elevating the head of the bed decreases intracranial pressure and strictly prevents cerebrospinal fluid from leaking out the nose. Question 183. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura. The client's platelet count currently is 80,000. It is most important to teach about: Option A. Bleeding precautions. Option B. Prevention of falls. Option C. Oxygen therapy. Option D. Conservation of energy. The correct answer is option A. Bleeding precautions. Idiopathic thrombocytopenic purpura marks the destruction of platelets. The patient must adhere to strict bleeding precautions to prevent fatal internal hemorrhages. Question 184. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor: Option A. Platelet count. Option B. White blood cell count. Option C. Potassium level. Option D. Partial prothrombin time. The correct answer is option A. Platelet count. Because the disease fundamentally destroys platelets, tracking the absolute platelet count is the only direct way to evaluate if immunosuppressive therapy is working. Question 185. A 21-year-old male with Hodgkin's lymphoma is to begin radiation. He is engaged to be married. Which of the following would be a priority for this client? Option A, sexual dysfunction related to radiation therapy. Option B, anticipatory grieving related to terminal illness. Option C, tissue integrity related to prolonged bed rest. Option D, fatigue related to chemotherapy. The correct answer is option A, sexual dysfunction related to radiation therapy. Pelvic radiation destroys rapidly dividing sperm cells. Fertility preservation and sexual function are absolute top priorities for a young, engaged male. Question 186. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Option A, oral mucous membrane altered related to chemotherapy. Option B, risk for injury related to thrombocytopenia. Option C, fatigue related to the disease process. Option D, interrupted family processes related to life-threatening illness. The correct answer is option B, risk for injury related to thrombocytopenia. Leukemia crowds out healthy bone marrow, leading to profound thrombocytopenia. A risk for fatal bleeding injury is the highest physiological priority. Question 187. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire about? Option A. Have you noticed a change in sleeping habits recently? Option B. Have you had a respiratory infection in the last 6 months? Option C. Have you lost weight recently? Option D. Have you noticed changes in your alertness? The correct answer is option B. Have you had a respiratory infection in the last 6 months? Leukemia destroys the production of healthy white blood cells. A history of recurring infections is a hallmark indicator of the disease's progression and severity. Question 188. An African American client is admitted with acute leukemia. The nurse is assessing for signs and symptoms of bleeding. Where is the best site for examining for petechiae? Option A, the abdomen. Option B, the thorax. Option C, the earlobes. Option D, the soles of the feet. The correct answer is option D, the soles of the feet. In dark-skinned individuals, petechiae, tiny microhemorrhages, are most visible in areas with lighter pigmentation, such as the soles of the feet or palms of the hands. Question 189. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following would the nurse inquire about as a part of the assessment? Option A. The client collects stamps as a hobby. Option B. The client recently lost his job as a postal worker. Option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Option D. The client's brother had leukemia as a child. The correct answer is option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Previous high-dose exposure to radiation or chemotherapy is a massive, highly documented environmental trigger for developing secondary acute leukemias later in life. Question 190. The nurse is teaching the client with polycythemia vera about prevention of complications. Which statement by the client indicates a need for further teaching? Option A. I will drink 500 milliliters of fluid or less each day. Option B. I will wear support hose when I am up. Option C. I will use an electric razor for shaving. Option D. I will eat foods low in iron. The correct answer is option A. I will drink 500 milliliters of fluid or less each day. Polycythemia vera makes the blood thick as sludge. Restricting fluids causes severe dehydration, which makes the blood even thicker and guarantees a deadly blood clot. Question 191. At discharge, the nurse advises a client about a calorie-restricted diet. What is an ideal rate of weight loss? Option A. 1/2 pound per day. Option B. 1/2 pound per week. Option C. 1 pound per week. Option D. 1 pound per day. The correct answer is option C. 1 pound per week. A steady, controlled weight loss of 1 to 2 pounds per week is considered physiologically safe, sustainable, and prevents the loss of lean muscle mass. Question 192. A liver scan is prescribed for a client prior to surgery. Which description best describes this procedure? Option A. The client will ingest radioactive material and have venipuncture performed. Option B. The client will stand in front of a machine that takes X-ray pictures. Option C. The client will lie still while a scanning probe is passed back and forth over the body. Option D. The client's skin will be lubricated with oil and ultrasound pictures will be taken. The correct answer is option C. The client will lie still while a scanning probe is passed back and forth over the body. A traditional nuclear medicine liver scan involves injecting a radioisotope and using an external gamma probe to scan back and forth to measure hepatic uptake. Question 193. After administering pain medication to a client, it is most important for the nurse to take which action? Option A. Do not disturb the client. Option B. Keep the environment cool and quiet. Option C. Provide diversionary activities at short intervals. Option D. Determine whether the medication is effective. The correct answer is option D. Determine whether the medication is effective. The nursing process requires evaluation. The nurse must reassess the patient to definitively determine if the analgesic intervention actually relieved the pain. Question 194. The nurse provides care for a client beginning intermittent heparin therapy. The nurse knows which laboratory test is used to monitor the effectiveness of heparin. Option A. Activated partial thromboplastin time. Option B. Prothrombin time. Option C. Bleeding time. Option D. Protein electrophoresis. The correct answer is option A. Activated partial thromboplastin time. The activated partial thromboplastin time, APTT, precisely measures the intrinsic clotting pathway, which is the exact physiological cascade that heparin disrupts. Question 195. The nurse provides care for clients in a long-term care facility. Which client indicates a need for the nurse to reinforce teaching about the use of assistive devices? Option A. Client uses a swing-through crutch gait to prevent weight bearing. Option B. Client places weight on the axilla when taking a step using crutches. Option C. Client lifts the walker, moves it forward then walks into it. Option D. Client places a cane in the hand of the side of the unaffected leg. Option E. Client uses a 4-point crutch with no weight bearing on the affected leg. Option F, B, D, E. The correct answers are options E and E and E and E and E and A and A and A and A and D and E and E and E and E and E and D and A and A and E and A and C and A and E and E and D and E and D and E and A and F and A and E and E and E and B and E and A and B and E. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a swing-through crutch gait to prevent weight bearing. Client places a cane in the hand of the side of the unaffected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client places a cane in the hand of the side of the unaffected leg. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a swing-through crutch gait to prevent weight bearing. Client lifts the walker, moves it forward then walks into it. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client places a cane in the hand of the side of the unaffected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client places a cane in the hand of the side of the unaffected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a swing-through crutch gait to prevent weight bearing. B, D, E. Client uses a swing-through crutch gait to prevent weight bearing. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a 4-point crutch with no weight bearing on the affected leg. Client places weight on the axilla when taking a step using crutches. Client uses a 4-point crutch with no weight bearing on the affected leg. Client uses a swing-through crutch gait to prevent weight bearing. Client places weight on the axilla when taking a step using crutches. Client uses a 4-point crutch with no weight bearing on the affected leg. No explanation provided. Question 196. A client with a diagnosis of ovarian cancer experiences severe pain. Which principle does the nurse remember when caring for this client? Option A, caution must be used to prevent narcotic addiction. Option B, cancer pain is mostly psychological and is unable to be completely controlled. Option C, pain medication should be given when the client exhibits physical signs of pain. Option D, pain medication is more effective if given before pain becomes severe. The correct answer is option D, pain medication is more effective if given before pain becomes severe. Staying ahead of the pain cycle by administering analgesics before pain becomes agonizing blocks the severe windup of the central nervous system's pain pathways. Question 197. Which nursing action is best to identify and manage a client's valuable items during hospitalization? Option A, tell the client to place valuable items in the bedside table. Option B, inform the client the nurse will hold on to any valuable items. Option C, document the disposition of the client's valuable items in the medical record. Option D, leave any valuable items at the nurse's station. The correct answer is option C, document the disposition of the client's valuable items in the medical record. Hospital liability is strictly managed through meticulous documentation. Charting exactly who took the items home or placing them in a hospital safe protects both patient and staff. Question 198. The nurse provides care for a client with an abdominal wound. The nurse notes there is purulent drainage from the wound. Which action does the nurse take first? Option A, contacts the healthcare provider. Option B, places the client on contact precautions. Option C, irrigates the wound. Option D, asks the client to identify the level of pain on a numeric scale. The correct answer is option B, places the client on contact precautions. Purulent, pus-filled, drainage indicates an active bacterial infection. Immediately isolating the patient with contact precautions protects the rest of the unit from an outbreak. Question 199. The nurse prepares a client for discharge. The client tells another staff member that the nurse really does not care about them and they do not want to talk anymore. Which interpretation by the nurse is best? Option A. The client has expressed readiness to think and act independently. Option B. The nurse has done something to offend the client and needs to apologize. Option C. The client is not ready to go home and discharge should be delayed. Option D. The client has a common response to the end of the nurse-client relationship. The correct answer is option D. The client has a common response to the end of the nurse-client relationship. Anger and sudden withdrawal are classic, well-documented psychological defense mechanisms used by patients to cope with the anxiety of losing a trusted care provider. Question 200. A middle-aged adult client is admitted to the hospital for hematuria. The client has no previous history of illness, is married, and has 3 children in high school. Which task of middle adulthood is most likely to be disturbed? Option A, assisting the children grow into adulthood. Option B, coping with a role transition. Option C, renewing earlier relationships. Option D, developing adult leisure time activities. The correct answer is option A, assisting the children grow into adulthood. According to developmental theorists, the primary task of middle-aged adults is generativity, specifically, guiding, providing for, and assisting the next generation. Question 201. The nurse prepares to insert a Foley catheter into the client. It is most important for the nurse to take which action? Option A, place all supplies close to the edge of the table. Option B, keep the field holding the supplies in front of the nurse. Option C, set up the field below the nurse's waist level. Option D, add only clean supplies to the field. The correct answer is option B, keep the field holding the supplies in front of the nurse. A sterile field must always remain in direct, continuous line of sight. Turning away or dropping hands below the waist instantly breaks the strict rules of sterility. Question 202. The nurse does discharge teaching with a client that has a new diagnosis of eczema. Which common foods are likely contributing factors of eczema that the client should eliminate in the diet? Option A, fish, nuts, and chocolate. Option B, strawberries, tomatoes, and apples. Option C, milk, wheat, and egg whites. Option D, soybeans, orange juice, and egg yolks. The correct answer is option C, milk, wheat, and egg whites. Cow's milk, wheat gluten, and egg whites are the most highly allergenic dietary proteins globally and are infamous for triggering severe eczema flare-ups. Question 203. The clinic nurse interviews a middle-aged adult client who reports difficulty sleeping and ongoing fatigue. The nurse learns the client frequently works the night shift. Which is the best initial statement for the nurse to make? Option A, tell me about your usual sleeping habits. Option B, you probably sleep when you can during your night tour. Option C, this is normal for your age group. Option D, working the night shift is known to disrupt sleep patterns. The correct answer is option A, tell me about your usual sleeping habits. An open-ended assessment statement gathers vital, patient-specific data without making assumptions, which is the required first step of the nursing process. Question 204. When witnessing a client's signature during informed consent, it is most important for the nurse to make which assessment? Option A, does the client understand the procedure? Option B, does the client have any questions? Option C, does the client give consent voluntarily? Option D, is the client able to write their name? The correct answer is option C, does the client give consent voluntarily? The nurse's legal signature purely attests that the patient is the person signing and that they are doing so freely, without any coercion or heavy sedation. Question 205. The morning before surgery, a client signs an operative consent form. Soon afterward, the client calls the nurse and states they do not want the surgery. Which action does the nurse take first? Option A, notifies the healthcare provider of the client's decision. Option B, informs the client the decision has delayed the operating room schedule. Option C, encourages the client to discuss reasons for canceling the surgery. Option D, asks the client's family to encourage the client to have the surgery. The correct answer is option C, encourages the client to discuss reasons for canceling the surgery. Patients have an absolute right to withdraw consent at any time. The nurse must first therapeutically explore the patient's fears or concerns before escalating. Question 206. The nurse identifies which change in the pattern of urinary elimination is usually associated with client aging. Option A, decreased frequency. Option B, incontinence. Option C, sphincter reflexes decreased. Option D, formation of bladder calculi. The correct answer is option C, sphincter reflexes decreased. As humans age, the smooth muscle tone and neurological reflex of the urinary sphincter naturally weaken, decreasing the ability to forcefully hold urine. Question 207. While a client is being treated for a wound infection, it is most important for the nurse to routinely perform which action? Option A, check and record the client's temperature. Option B, send samples of wound drainage for culture. Option C, assess the perfusion in the area. Option D, evaluate the results of the blood culture. The correct answer is option A, check and record the client's temperature. A rising core body temperature is the most rapid, direct physiological indicator that a localized wound infection has breached the bloodstream and is turning systemic. Question 208. The nurse assesses an older adult client. Which statement does the nurse expect the client to make? Option A, I seem to get fewer upper respiratory infections than I did before. Option B, I think that I am a little taller than I used to be. Option C, eating just does not appeal to me anymore. Option D, I have been sleeping with fewer blankets lately. The correct answer is option C, eating just does not appeal to me anymore. Aging naturally blunts the olfactory and gustatory nerves, causing food to lose its taste and smell, frequently resulting in a severe loss of appetite. Question 209. The nurse knows that serum albumin is used as an indicator of malnutrition for which reason? Option A, albumin from eggs is commonly ingested and constant in the diet. Option B, albumin is the first result on a protein electrophoresis. Option C, serum albumin is easy to measure and can indicate a protein deficiency. Option D, serum albumin has a short half-life making it an easy protein to measure. The correct answer is option C. Serum albumin is easy to measure and can indicate a protein deficiency. Serum albumin is a massive plasma protein manufactured by the liver. Chronically low levels are the cheapest, easiest, and most reliable blood indicator of prolonged malnutrition. Question 210. Which nursing action does the nurse have to establish first when caring for a client in pain? Option A. Teach the client about the pain. Option B. Establish a trusting relationship with the client. Option C. Determine how various relaxation techniques affect the pain. Option D. Administer pharmacological agents. The correct answer is option B. Establish a trusting relationship with the client. Pain is entirely subjective. If a patient does not trust the nurse, they will severely underreport their pain or refuse medication, entirely derailing effective treatment. Question 211. An older adult client asks why they are having constipation. Which rationale does the nurse use regarding the primary reason for constipation for this client? Option A. Older adult clients eat smaller amounts of food with decreased bulk. Option B. Older adult clients have less physical activity and decreased muscle tone. Option C. Older adult clients have neurological changes in the gastrointestinal tract. Option D. Older adult clients have decreased sensation in the gastrointestinal tract. The correct answer is option B. Older adult clients have less physical activity and decreased muscle tone. A sedentary lifestyle combined with naturally weakening abdominal and bowel musculature severely slows down peristalsis, causing chronic constipation in the elderly. Question 212. The nurse explains to the nursing student that a client has a new diagnosis of psoriasis. Which best describes psoriasis? Option A. Chronic autoimmune reaction. Option B. Acute infectious disease. Option C. Viral disease. Option D. Cystic, self-limiting disease. The correct answer is option A. Chronic autoimmune reaction. Psoriasis is a non-contagious, chronic autoimmune disease that hyperstimulates the skin, causing epidermal cells to rapidly multiply and form thick, silvery plaques. Question 213. Following a total hip arthroplasty, the elderly client is ordered to begin ambulation with a walker. Which statement by the nurse is best? Option A. Sit in a low chair for ease in getting up to use the walker. Option B. Make sure rubber caps are in place on all four legs of the walker. Option C. You will begin weight bearing on the affected hip soon. Option D. Practice tying your own shoes before you begin ambulating. The correct answer is option B. Make sure rubber caps are in place on all four legs of the walker. Safety is paramount. Without intact rubber caps, a metal walker will instantly slide out from under the patient on a hospital floor, causing a devastating fall.